We know that health inequities disproportionately impact the African American community, and it's often said that when the world catches a cold, the Black community catches the flu. And the coronavirus pandemic, it heightened that to another degree, which has been unprecedented in our communities because we see the suffering that existed prior to coronavirus, where we had our communities that were suffering disproportionately from diabetes and hypertension, asthma, and many other health ailments. Within the African American community, we have a higher percentage of people that work within essential workspaces, who are first responders, who are frontline workers, who work as laborers within the community. We have a high number of both African American and Latinx populations that work in grocery stores, that work on front lines.
Public policymakers have to ensure, one, that the policies that are implemented not only protect people's public health, address an advocacy of public health from an equity perspective, but public policy also should make sure that people have access to testing, have access to vaccination.
We need to ensure that COVID testing is readily available and widespread throughout the District of Columbia, because when we know where our COVID results are and where our most impacted areas are, it allows public policy officials and public health officials to know how we can best serve and support our communities. If we know where our most impacted communities are, we can advocate for resources to go to those communities.
Our job is to get consistent, accurate information out there so that people will consistently see the value of testing, will consistently see the value of vaccination, and begin to push back on a lot of the misinformation that's out there.
Anytime that information is looking to reach the community, particularly our most vulnerable communities, it's important that respectable community-based organizations, churches, faith-based institutions, trusted organizations are empowered with information to get out to their constituents in the community.
This is an issue that we're going to have to certainly stay the course with for a long time. So we're going to have to make sure that our folks, and many of the communities that we serve, are very much involved in becoming educated. So we encourage folks to do your fact checking, follow the science, certainly follow the medicine on this issue to make sure that you are definitely getting correct information.
As the vaccine awareness and vaccine hesitancy is combated and addressed, there's a continued need, whether people are vaccinated or unvaccinated, to be tested and to know their status.
Testing has to be a part of how we live our lives. Getting vaccinated regularly has to be a part of how we live our lives. We need more testing. We need more vaccination. We need more information consistently. So I would say that we're midstream. We're not across the troubled waters yet. And so one way to get fully across the troubled waters is to have more testing, more vaccination, more consistent information out to communities, particularly who are most vulnerable.
We want our testing facilities to remain strong and to be located in our most vulnerable communities. We need to ensure that our vulnerable communities have access to testing regardless of what the pandemic is, because testing allows any community and any individual to know their status so that they can advocate for the safety, the health, the well-being, and the overall holistic health of their family and community. Health is the foundation to any work that we do. So a healthy people, a healthy person, a whole person is required to be an activist. So it's essential that we as a people stand on a healthy community and we stand on the shoulders of healthy people. So it's important that we embrace our own health so that we are a stronger community with a strong foundation to be able to move forward stronger together.